Okay, good morning to everybody. I thank the organizers and especially Luisa for inviting me to speak here this morning and to present our more recent data. Antimicrobial resistance occurs when microorganisms no longer respond to antibiotics, rendering the antibiotic therapy ineffective. And actually, as it was mentioned this morning, antimicrobial resistance today represents a silent pandemic estimated to have contributed to over 4.9 million deaths worldwide in 2019. And just to put this number into perspective, estimate of the number of deaths caused by the SARS-CoV-2 during the first year of the pandemic range between 1.8 and 3 millions. But not only the death, so the loss in human lives, but also the indirect effect of antimicrobial resistance are very dangerous, as key and widespread medical procedures such as intestinal surgery, cesarean section, joint replacement, or other could become too risky without the support of an antimicrobial therapy. So for this reason, it is believed that because of antimicrobial resistance, the achievement of the modern medicine is at risk. And if the trend is not quickly reversed, it is estimated that in 2050, death from multi-drug resistant infection will probably exceed those due to cancer. So it is clear that in this scenario, there is an urgent need of antimicrobial strategies alternative to antibiotic use that may target antimicrobial resistant pathogens. And many of these strategies are today under investigation in many laboratories all over the world. And I should say that the task is not easy at all, because these antibiotic alternatives should be highly target-specific, non-toxic, not inducing resistance, and possibly also economic and environmental friendly. So in this context is working the group of the researchers within the Spoke 7 of the sub-project 5 at the University of Pisa in the Tuscany Health Ecosystem, and some of them are working on some of these new strategies, such as phytochemicals, antivirulent strategies, drug repurposing, metals, or phage therapy. Of course, due to time limit, I do not have time to talk about all of them, but I will concentrate on the possible use of probiotics and postbiotics to prevent or treat infectious diseases. The local application of harmless microbes, the so-called probiotics, is an emerging antimicrobial strategy called bacteriotherapy. And the general strategy is to exploit the natural competition among bacteria, using beneficial bacteria to fight against pathogenic ones. And the mechanisms of action are several. For example, probiotics may interfere with the pathogen adhesion to epithelial layers of the host. They may produce an array of bioactive substances that contrast pathogen growth and virulence, and also they may stimulate the immune system, reduce inflammation, enhance mucosal barrier integrity, and also stimulate healing. But we have to consider that behind viable bacteria, also probiotic derived inanimate preparations that are actually called postbiotics are an emerging antibacterial strategies, and they may have some advantages in terms of safety, especially in vulnerable or immunocompromised individuals, and they might be easier to produce and storage. So in my presentation, I will show you two major examples of our work. The first one, the use of live probiotics for the treatment of infected wounds. And the second one, the use of postbiotics for the treatment of respiratory infections. Chronic wounds such as diabetic, venous, pressure ulcers affect millions of people worldwide, and the incidence is expected to rise with the general aging of the world population. So a few clinical studies have demonstrated that the local administration of probiotic to an infected wound may have positive outcomes in terms of reduction of the bacterial load and also wound healing. But the problem is how to administer the probiotic to the infected wound. So the challenge is to develop adequate delivery systems of a live probiotic that may ensure the preserve probiotic vitality and prolong their shelf life until use. So aim of our work was to develop a sort of bandage or patch as delivery system of live probiotics and to test their antibacterial activity against bacterial strains isolated from infected wound. So briefly, the method developed in collaboration with Professor Renadanti from the University of Pisa. We optimized a custom-made bio-ink, and we mixed the bio-ink with the commercial formulation of probiotics containing several probiotic strains, and the mixture was then printed with next generation bioprinting to obtain the probiotic-laden patches. As you can see here, the bio-ink demonstrated a good printability, and both hollow and solid geometries were printed and easily ended with the potential to adapt to different wound shape. Then we also demonstrated that the printing procedure had no major effect on probiotic vitality, and also the developed patches showed an evident antimicrobial effect in standard laboratory conditions. As you can see here, this clear zone all around the patches is indicative of bacterial inhibition that was demonstrated against several bacterial strains, E. coli, Staphylococcus aureus, and Pseudomonas aeruginosa, differently to what observed with the control patch, which were empty, without probiotics. But microbiology laboratory is quite different from the in vivo situation, where there are several factors that may hamper the activity of new antimicrobial strategies. So, for example, in vivo, bacteria tend to grow as aggregate called biofilms. There are also proteins such as fibronectin, collagen, which facilitate bacterial attachment, and there are host components that may hamper the activity of antimicrobials. So the next step was to test the probiotic-laden patches in an in vivo-like wound infection model. And briefly, the model consisted in a matrix of collagen type 1, which is the main component of the dermal layer in the skin, which was used as substrate for the biofilm formation. And then everything is included in an artificial liquid, which is a simulant wound fluid, which mimics the composition of the wound inflammatory exudate. So we developed the model, and then we infected with bacteria. We used Pseudomonas aeruginosa, which is one of the main wound pathogens. And once the biofilm was formed, we treated with the probiotic-laden patches. And after 24 hours of incubation in vitro, we quantified the number of survivor Pseudomonas as compared to the untreated samples. And as you can see here in this part of the graphic, the patch-treated samples showed a marked decrease in the biofilm-associated bacteria, around 2.5 log, which correspond to more than 99% in the number of viable bacteria as compared to the untreated samples. But this was obtained only when we supplemented the medium with glucose as supplementary nutritional component. So the systems look promising, but of course it needs further optimization. The second example is the use of postbiotic for the treatment of respiratory infections. In this case, we obtain postbiotic from a common probiotic, Lactobacillus rhamnosus, with a simple procedure. I will not enter into detail. And we use this postbiotic in an air-liquid interface lung infection model to mimic the condition found in the lung epithelium. In this case, the model briefly consists in a layer of epithelial cells directly in contact with air. Scusate un attimino. Okay. Directly in contact with air, and in 8-10 days of culture in the presence of a differentiation medium, the monolayer differentiates in a polarized monolayer with morphological and functional feature of the in vivo airways, as you can see in this scanning electron microscopy image, where, for example, is clearly visible the ciliation of the epithelium. Then we infected the model with the bacteria. Again, we use Pseudomonas aeruginosa, as it is also one of the major respiratory pathogens, and the bacterium showed the ability to grow well in the model, and so we treated the infected monolayer with the postbiotics. So here are the main results obtained. We observed a strong anti-pseudomonal activity of the postbiotic with a reduction of 3 logs, which means more than 99% of the live P. aeruginosa in the model. This result was also confirmed by scanning electron microscopy. As you can see here, in the untreated monolayer infected with Pseudomonas, these bacterial aggregates were visible, resembling the early stage of biofilm formation, while these aggregates were virtually not visible in the infected and treated samples with postbiotic. The active concentration were not toxic for the host cells, and importantly, the postbiotic did not induce resistance following multiple passages at sub-inhibitory concentration, as unlikely, for example, a commercial antibiotics, ciprofloxacin, which rapidly induce resistance against both P. aeruginosa and Staphylococcus aureus. So we were encouraged by these promising results, and we further evaluated the translational potential of our postbiotic, and in collaboration with Prof. Anna Maria Piras from the Department of Pharmacy of the University of Pisa, we developed a liquid formulation of L. rhamnosus postbiotic for aerosol administration, and we studied the aerodynamic distribution to the lung in an air in vitro model of the pulmonary system. To do this, we use a next-generation impactor, which is a device acquired within the THE project. Professor Piras yesterday described the instrument within the Spoke 4, and briefly it consists in a device connected with a breathing simulator, and it consists in several cuffs which correspond to the several stages from 1 to 7, which in turn correspond to the different zone of the airways, the upper, the central, and the lower airways. So the results obtained demonstrated that more than 60% of the aerolized postbiotic were able to reach the stage 4, 5, and 6 of the device, and they were made of fine particles with a mass median aerodynamic diameter less than 5 micron, which is ideal for the for reaching the deep airway. So, in conclusion, we demonstrated the promising antibacterial activity of live probiotic embedded in a 3D printed patches, and in condition closely resembling the wound bed. And also we demonstrate in an early lung infection model that L. rhamnosus postbiotics were effective in their antibacterial activity at non-toxic concentration and their potential to reach the deeper regions of the lung. So ongoing studies are addressed as stability studies, fractionation of postbiotics to identify the active components, optimization of the delivery system, and also the study of the anti-inflammatory potential, and hopefully quite soon in vivo testing in the mouse model. I would like to thank all the people in mine and also in other groups involved in the UNIPI Spoke 7 sub-project 5. And also I would like Luisa Bracci, the coordinator of the Spoke 7, and all of you for your kind attention.